Hello, I'm Dr. Jang from Seoul, South Korea. If you've ever watched an old war movie, you might remember scenes where someone bites down on a cloth or a piece of wood while having an arrow pulled out or a wound stitched up. It looks incredibly painful. But back in the day, before anesthesia, that was sometimes the only option for survival. Fortunately, modern medicine has advanced to the point where minimizing pain is a top priority. Yet, strangely enough, circumcision is still widely perceived as a particularly painful procedure. You might be surprised to know how many men are actually interested in getting circumcised, but don't go through with it. They have their reasons, of course. But in most cases, the main concern is pain. They've seen friends or family suffer after the procedure and think, there's no way I'm doing that. And really, who could blame them? It's not a life-threatening issue, so most men just put it off or avoid it altogether. That's why, over 10 years ago, I developed a technique specifically designed to reduce pain after circumcision. Since then, I've successfully performed this procedure on many patients. Now, I won't claim it's completely painless. That wouldn't be honest. But here's what I can say. Most of my patients return to work the very next day without any major discomfort. That's something you'd rarely hear after a conventional circumcision. So, what makes this method different? It all comes down to blood flow, specifically preserving the penile blood vessels. In standard circumcision, many of these vessels are damaged when removing the foreskin. This leads to swelling, pain, and slower healing. In contrast, my method, called the ultra-thin flap circumcision, removes only the outer skin while carefully preserving the underlying blood vessels. This allows for better post-operative circulation, which means less swelling, reduced pain, and faster recovery. That's how confident I am in this procedure. In fact, I offer a full refund guarantee. If you're unable to return to your normal routine the day after surgery because of pain, I'll refund the full cost. Honestly, no surgeon would offer that unless they were truly confident in their results. If you'd like to learn more about this technique, feel free to check out my previous videos where I explain it in greater detail.